And some additional ideas for getting organized and staying organized. One thing is to try to create a place for everything if you can. That seems to be the most helpful thing with organizing. Having cabinets or files or just a place where things can go so they're not just kind of exploding all over the place. Trying to avoid procrastination is important. That's hard because, I like this little fortune cookie, stop procrastinating starting tomorrow. I think that's the tendency of some folks to just wait because, you can always do it tomorrow. Why do today what you can do tomorrow? But if you're going to be organized, trying to avoid the procrastination is helpful. Eliciting the help from other organized people. So this can be really great. If you just tend to be kind of a disorganized person and that's just the way you are, it's okay to ask for help. It's okay to ask that friend that you know is super organized to help you. Chances are, if you know somebody who's super organized, they probably really like organizing, so they're probably going to be willing to help you if you need that. Setting priorities at the beginning of the day can be helpful. So just starting the day off with, okay, what is priority? What needs to happen today? What do I need to get done to help you focus and not get off task? It's often important to remind ourselves to, especially caregivers who I feel like are multitasking all the time, trying to do a million things at once, to remember to try to unitask as well. So although you may be pulled in a million directions and you may want to multitask, if you're trying to get organized, try to do one thing at a time versus 5 things at a time where you have to split all your resources and energy. When it's really something important, you want to multitask versus unitask. And then, disperse information in an organized manner if you can. So I think caregivers are often given the task of giving updates to family, friends, dispersing information on what's going on, how's treatment going, how did surgery go, how's so-and-so feeling. So if you can find a way to help you get organized, that's great. So there are things like Caring Bridge, which is kind of like an online blog or journal where you can write updates and then people can sort of follow that, or they can check in there for an update. So you're not constantly having to make a million phone calls, send a bunch of emails. You can put the information in one place and other people can be responsible for checking in there to get the information. Email chains can be helpful, phone chains. Having a go-to person and saying, hey, I want to make you the person responsible for dispersing information, so you just have one person to tell, and then let them give the information, whether that's through email or through phone, or Facebook is something people seem to use a lot these days as well for giving updates. And then just making sure that you're taking care of yourself as a caregiver. There are lots of options. James Care for Life has, it's actually November is National Caregiver Month. So in November, there's a conference for caregivers. There are some other things around. The Central Ohio Area for Aging, or Central Ohio Area Agency on Aging, has caregiver support groups, and they are non-disease specific. So this could be any disease where you are a caregiver. It could be cancer, Alzheimer's, dementia, any kind of chronic disease. So I think support groups or anything where there are other caregivers present, it's always really nice to be able to say, like, what do you do? How do you get organized? Asking other caregivers what they do, because they're going to be your best resources. Asking others how they get through and how they organize.